Hello, Jerry. This is Karthik. How are you doing today?
Well, how are you?
Good, good. I'm doing well. And the weather seems to be nice now with summer going on. Are you doing anything fun?
We've had my son's birthday.
Oh,
His birthday was today, and then we
I
had
see.
him over for dinner yesterday. But we pretty much today stayed inside. We usually are out on the deck because it's usually, but it's
I
been hot. So no, we
so
haven't done much today except just kind of recover from the birthday party.
do you walk in the community neighborhood and do you see a lot of people walking in the evenings times?
We walk 2 or 3 times a week, 2 miles, 2.5 miles each time. We don't see many people out there.
Oh, I see. So
Around here, it's very quiet.
it's very
You,
quiet. Is it
you,
because the community has less number of people who are coming out, or is it because they are all in quarantine, do you think?
I don't know. It's puzzling because the children aren't coming out either. They're not coming out much and outdoors. Um, During the week, I can understand. I guess that maybe they're trying to do the viral thing, but no, it's been very quiet,
I see. That's
except for
surprising.
the
Hmm.
traffic on Randall Road is back to normal. So that's a good indicator,
Mm.
I
So, but
guess.
right. Do you see that the number of cases of deaths have reached 150,000, which is staggering and really stunning for a country like US? And it's really concerning. The cases are surging. The first wave of cases happened in East Coast. New York City has been hit. Now the southern states are really impacted. Looks like Florida, Arizona, and Texas. What do you think as a community we should do as individuals as well as in groups that we should be containing the virus? It looks like there's no vaccine, there is no what do you call a treatment at this time. So as experienced health professional, you've seen the industry. What are some of the suggestions you would like to give to the people?
Well, I wish I could be positive in terms of finding a vaccine I think we found some treatments, but they haven't received credibility. And I think they need to be, used more widely. And we need to have information on that rather than the number of cases that we don't have categorized at all. It's one case is as bad as another one. And we don't have any calculation of what age group or where where it's most likely to cause a death. I just come back to the probabilities are not provided. So I don't know if anyone is actually calculating through any kind of actuarial software where this thing is truly going based upon deaths that are truly uh, primarily the COVID,
Mm.
rather than somebody having a heart attack, but then while they're in the hospital, they died of COVID-19. I mean, again, you hear that on the news that's happening. So I think that the problem that each individual has, because each individual's risk is different. We can't treat everyone the same, and we're treating everybody being equally at risk because of our immune system. Well, our immune systems are all in differing degrees of strength or weakness, with their underlying lifestyle and physical and mental condition. Being housed or locked up in your home doesn't lead to a healthy mind nor a healthy body. And I was going to read some statistics here in terms of, because let me read this. This was in the ARP magazine.
The
It's
AARP magazine.
yeah,
Okay.
the retiree magazine.
Okay.
Search of a timeline. In normal non-pandemic timeline, effective vaccines takes years to develop. When you take into consideration breaking down an antigen, producing the right immune response, figuring dosage and moving into chemical trials and clearing every regulatory hurdle, and then producing a product and bringing it to market, you're talking 3 to 5 years. This expert says his prediction no earlier than fall of 2021. Fauci's latest prediction of early next year is far more optimistic, of course. In the end, no one really knows how long it will take to develop vaccines and therapies. But one thing is completely in your control: get healthier. The data is pretty clear on people who are healthy and active and who control their weight. Evans says all those things are associated with better immune response. Not only the better you'll respond to the vaccine when it's available, the better you'll respond if you get the coronavirus. Improving your health could be a very useful summer project, which it has been for most people, because while all the oxygen goes to the pandemic, Evans reminds us that we have another flu season approaching on top of this virus, especially for those over age 60. He says an active lifestyle, eating healthy, sleeping well, and all that drives your immune system in the right direction. So, you know, the statistics on your normal American, and this is in my book called America in the Red Zone, 66% of Americans don't exercise regularly. 45% don't read the labels on the food they're eating. 25% ingest some form of mind-altering drugs or prescription drugs. 90% are stressed. Most have sleep deprivation, and the statistic that's being stated is 6 hours a night on average. So the point being is that each individual is a separate case. We're discounting cases without regard to risk, and each individual is the only one that can determine that. But we're not allowing individuals to make these decisions. They're being made by, you know, the task force, or by the governors or the mayors, or our neighbors who are scaring the hell out of us by not wanting to shake our hand or even be near us. So, I mean, my point, the bottom line is that we're still fighting a war with fear, not with our immune systems. Now, some of them are at way more risk than others, and I think we know who they are. And we should have known this in the beginning, because we could have focused on that. But now we're back to focusing on everybody. You know, I read an article on herd immunity, and the likelihood of that happening, it happened with measles, but no one really can anticipate how that's going to work with this virus, if at all. Because it's got to get down to the point that where the most that you could infect someone is one other person. That's called herd immunity. And the only way we'll get to that is where everybody's got enough courage to just see if we can find that point, because we need that for the future.
Right.
We cannot apply what we've just done to the future, because we're surely going to create a bigger pandemic than we've had with this one. And it's being used as an agenda in politics, which is another
problem.
Confusing problem.
So that's a good, first of all, I really like the statistics you put together in terms of number of people who don't exercise versus number of people who don't read labels. It's a very interesting stat. And the number of people who don't, who are on medications for any, sleep disorder, and then the people who are undergoing stress. I think these are great statistics. At the same time, I also agree with the fact that herd immunity is going to take a long time, because which means that you have to develop the immunity of the whole country. That's not going to happen in any time soon.
No.
Which means, and the pandemic is on us, which is really taking away kids' schools away from them, jobs from people, entertainment for people who want to go out and eat, or go to a movie theater, or attend a bar, go to a bar, or a concert. So what should we be doing with? And you also rightly pointed out that the vaccine is going to take years to come into place. So what should we be doing in the immediate next step? Because this is going to stay with us, with also ongoing onsetting flu season coming. this pandemic as well as the flu is going to be there for some time. So what do you think the governor should be doing to open up the economy at the same time keeping the people safe?
All right, well, there's another statistic, if you can believe it, of 125 with chronic disease codes that are used for prescription drugs and for doctor's visits and for Medicare to pay. Of those 125 million, they are the most at risk, other than those in nursing home long-term care. So we shouldn't be applying all of our strategies and tactics to 300 million or 320 million people when it's 125 million because of one reason or another. And I'm not saying it's always bad lifestyle. It could be cancer. It could be heart. My wife's got a congenital heart condition. But we should be focusing on how to manage the pandemic for where the risk is. And of course, we haven't. We have only taken the approach that we have to save everyone if we can. Well, I think we have to agree we haven't been able to do that. Haven't been able to do that since 1918. So we have to focus in on 125 million. They know who they are. The doctors know who they are. Those are the folks that we should be focusing our strategies on. You know, if saying everyone has to wear a mask and everyone has to do a lockdown seems to be an overkill. When in effect, we're talking about people that have underlying conditions that they themselves should be working on, and that should be part of the management of this. But that's even a big obstacle, because that's not going to happen overnight. But I think in general, if I get back to winning a war with courage versus fear, is if we continue to have the fear holding us from sending our kids to school so people can't work anyway, and we've already spent trillions of dollars on the lockdown, how far can we really go from a practical standpoint financially? And now they're talking about, someone said $2,000 a month, give it to everyone. Where's these trillions of dollars coming from? They're printing money, and that all it does is reduce the value of the dollar, and we'll have inflationary things happening. And I believe also the impact is that the prices are already starting to go up. You know, when you're at 100% capacity, the pricing is different than when you're at 25% capacity. So we're going to see an enormous jump in prices, regardless of whether we lock down or don't lock down or only allow 3 people. I mean, you go to the dentist, you can only have one person in the office at a time. I mean, how can you pay your rent and pay any employees, and you're certainly losing money.
Right.
So how long is it going to be until half of the small businesses in this country are filing for bankruptcy or just closing their doors? Because the cure is the result is way worse than the cure, because that everyone depends on is our economy and our kids going to school, and not even, I don't even expect us in the future to have a normal life if we continue to approach it this way. So the management of this, I believe, has to come from the individual. They have to be willing to take some risks. If we dictate everything and mandate everything, and you got to wear a mask and you got to stay 6 feet apart, that hasn't even proven to be effective, because we're getting a spike in cases. And so they can blame the protesters or the people out on the beach or whatever, but the strategy has not worked to treat everybody the same.
So what you're saying is, government should get out and then just let individuals decide what their situation is, and then do what is required, and then but the problem is, today's news, they say that this has become a kind of a community spread at this time. So let's say you going back to your reply earlier, you said out of 315 or 320 million people, the vulnerable are about 125,000 or 25 million people. So if we let everybody else open it up, during the community spread, how would you protect those vulnerable people, right? So that is the question I'm just thinking on, thinking aloud, that if, because I equally pain to see a lot of people losing jobs. They are not going back to their businesses are losing money. They are going to file for bankruptcy. It's very painful and hurting. But at the same time, if we have to really take care of that, so you are saying that let people be individually responsible for their own safety and let the economy open?
Well, I think we should focus. Not well. Uh, I, I'd like to say yes, but I don't think that's the right answer. I think we need to focus our testing and our contact tracing on 125 million, not on 350 million. The
Oh,
other, the other people must go back and assume their life, because the likelihood of them dying of it is 0.4%. Those are the calculations. Even in the last, since 1918, it's only been 0.1% based upon population of deaths. So yeah, every person's life is valuable, but there are certain people that have prepared themselves with a good, strong immune system, while others haven't. And children have that. They have the immune system that responds and prevents this. It's the only prevention we have going. We really don't have prevention in our healthcare system. We don't, we pay for, like I said in the last one, we pay for what we think we're supposed to get, but we don't get an outcome. We never quite know, what, I used the car. If you have a picture of a car and then you get a car, that's fine. In healthcare, we get a picture of an X-ray and we get a code. And if Medicare doesn't pay for it, then, or insurance doesn't pay for it, then we're stuck. So in healthcare, the way it is right now, we are not preventing anything. We are only increasing the number of pills that are pushed as a remedy, and they mask the problems rather than really solve the problems. And so that's the entree into the discussion of how the healthcare providers probably are not providing what they should. And to just give you a little view of what we pay for this, we have something over 4,000 hospitals. We pay them $2 trillion a year. We have close to 1 million physicians. We pay them $450 billion a year. We have 3 million nurses. We pay them, and probably underpay them, $145 billion. We have 350 health insurance companies on private insurance. We pay them $1.3 trillion. 33,000 pharmacies, 395 billion, and they're passing them, with my calculations based on my knowledge in nursing homes, about 8 billion pills in nursing homes a year. And and many of those are fentanyl for pain, oxycodone for pain. We have more drug addicts in the nursing homes than we have on the streets of America. And that is ridiculous, because all those are phone orders. Physician typically does not see the patient to order a medication or a medication change. We have 16,100 nursing homes. We pay them $82 billion, probably underpay them. And in those nursing homes, there's 1.7 patients. I call them patients, not residents. They didn't go there to rent out rooms. They went out, they should go there to get better and go home. And what was the other statistic? And each year we have 550,000 deaths in nursing homes. And we really don't publicize anything other than the nursing homes are just, if inferring they're killing off people, they aren't. They aren't really paid for restoring health and getting people back home, which is, I believe, we need to focus on that and the 125 million chronic diseases we have.
So are you saying that 550,000 people every year die in the nursing home?
Yes.
Nursing homes?
Yes.
Wow, that's a staggering number.
Most of it is from the flu.
Wow.
There's old age going on, but the average age in nursing home has gone from 85 to 70, because we're admitting more and more obese people and younger people into nursing homes, because there's no other alternative for long-term care. average weight used to be 150, 170 pounds. Now it's 250 to 300 pounds. So what we have is in our nursing homes is that we're breeding deaths that really shouldn't probably happen. They should be restored and try to get them back home rather than, on Medicaid for the rest of their life, because it isn't a good life. It's too much like a warehouse. And we owned them, we cleaned them up, we turned them around, and had to sell them because of the survey process. Just didn't want us involved. But I'm just saying is that we're spending almost $4 trillion a year on healthcare providers that do not focus on preventing much of anything. Surgery does, obviously it does. Therapies are trying to restore people. We need to start paying for outcomes rather than provider incomes.
Wow.
It's all on input. It's not on output. We don't have accountability for output and an outcome.
You brought in a bigger point, which is this, though pandemic has uncovered that the focus has to be not only, the 2 points I like in your reply just now is that focus on vulnerable people who are about 125 million here, out of which more than 500,000 people die in nursing homes every year. And the average age of people getting admitted into nursing home is coming down from 85 to 75, as you said. And the people who are admitted getting obese. So which means that we have a much bigger problem to handle there. And I think this brings up, your point is bringing up the overall healthcare of this nation. Though pandemic is the reason why we are discussing that, I think we have a much bigger problem to resolve in this country, actually.
Mm-hmm. Oh, absolutely. It's the foundation of a healthy country is the foundation of a
healthy economy.
A healthy American is the foundation for a healthy America. And as we're having to compete on a grander scale now, particularly with China, and some other countries are practicing better healthcare or have payment systems that are focusing on outcome rather than just paying providers income. We have to get through the pandemic. And usually they run out in a year to 18 months, and hopefully that'll happen here. But we have to learn from this that we have to start paying for outcomes, not just incomes.
Right.
I have 3 or 4 books on how we should do that and it's not savings. It is saving lives. There we can truly save lives. But we have to do it with turning off the faucet, like I had the analogy with Niagara Falls, turn off the faucet to the providers and only pay for outcome.
Right.
So there has to be some proven plan of care pursuing hopefully improvement and getting them not cured. It wouldn't hurt if we got some cures going.
So I think what you're coming back to is a great point, which is don't focus on medical care, because what nursing homes provide is medical care, but elevate it to a next level of healthcare for individuals, which means that healthcare is not just medical care. There's a clear distinction between it. So healthcare is an individual responsibility. They have to exercise. They have to keep improving immune system. They have to maintain their weight. They have to maintain a healthy lifestyle. And despite doing all of these, if they fall sick for whatever reason, because of unavoidable health issues like cancer or Alzheimer's, that is when they go to a nursing home so that they can take care of them. But not everybody should go in there. I think that will reduce the burden on the economy, the improvement of the healthcare, as well as that is the first thing. The second thing is we should also tighten the payment system for the healthcare providers so that they become more efficient and they are providing outcomes rather than income, is what you're saying.
Yes, and in the book, the boomers are coming. Since we're 77 million, I'm going to hit Medicare at 7,000 a day, and Medicare was predicted to run out of money by 2026 anyway. The problem there, of course, is that we have to manage their care. uh, from the physician to the hospital to the nursing home to assisted living to back home. We do not have systems that are connected to do that because we're using diagnosis as the principal driver at every level. And the diagnosis is just, it's symptomatic. It doesn't contain, unless you have a care plan built around that, to have a treatment plan that will move them from one level of illness to a lower level of illness. That's called outcome. And so we need to connect from the physician's office to the hospital, to the nursing home, to the assisted living home care, a continuum of care. And that takes process systems. And process systems are built around a cost accounting profile. Is that we have to set up a plan, we have to execute the plan on the basis of not diagnosis. A stroke is not a product. The problems are the solutions for that stroke, but we're paying for a stroke. We need to pay for problem by problem what we're going to get for the hospital at the hospital level, then continuing on down into the nursing home and into the home care, and then eventually they're out of the system.
So what you're saying is to understand from my layman's standpoint, when somebody is hit with a heart attack or a stroke you're considering as a symptom, you have to treat the underlying condition so that they improve as a overall individual rather than just that episode.
Yes, it'd be the problems that you're treating. It causes inability to walk, talk, eat, dress, all those activities of daily living, but it also affects your mental capabilities and your cognition. And so we need to be treating those as individual problems. The stroke is just the beginning, and that in many cases, it's either a left hemi or a right hemi. It affects different parts of your body depending on where it is. And so my feeling that rather building these processes off of diagnosis, that we build them off of body systems. Each of us has 11 main body systems. And it's like a car. You go to where that system that's impaired or in trouble and focus on that. Now, there are other corollary things that can happen from that. And then you treat that as that comes up. That simplifies it. Right now, we have 77,000 diagnosis codes, which these providers are looking up on their computers to see the best to get paid for in terms of either the amount or the length of stay or whether Medicare or Medicaid or private insurance will even pay for it. So there we get into codes. So every provider has a coder that they can make sure is doing a fantastic job of getting them the money.
Right.
It's not connected to any outcome. It's connected to a code.
Right. So this is a great summary, Jerry. I think we need to focus one episode on healthcare, and I want to expand the panel because to get in the next episode, let's try to get an expert, one doctor, like you are an expert on healthcare accounting, overall health, improving the healthcare of the people because you've seen closely and ran the healthcare centers. I want to get a customer who recently, one of our friend recently had his dad passed away, and then he wanted to share his experience on how the healthcare system affected the way he did things, as well as a doctor. And then maybe we should get somebody like a health administrators who works for a hospital. I want to expand this panel because you bring great points because I'm really interested in this topic because this pandemic has really opened the underbelly of this country. The underbelly of this country. Is it because if we get a vaccine, are we solving the problems of this country? If we get medicine for this vaccine, are we solving the problems? I think they have much bigger problems. We need to get a perspective, and I would like to leverage your expertise in this. At the same time, get different varied opinions from various people. Let's do a healthcare topic in the next episode. That will be a really interesting and
Okay.
eye-opening for more people. Because I'm a layman, I don't really understand. I understand general healthcare and medical difference, medical care versus healthcare difference, but I don't really understand how the medical system works for the elders, for the seniors. That will be a great enlightening topic for a lot of audiences. I think let's do that healthcare topic next episode.
Okay.
As
Yeah.
always, I really enjoy talking to you, Jerry. Thank you for spending your time with us to talk about these important issues at this critical juncture in this country.
Did you want to say anything about the mask situation, or should
Oh,
we leave?
yes. I wanted to actually talk about the masks as well. I forgot to ask that question. So, do you think wearing of masks will help people? Do you recommend it to people?
Well, I have to go back to focusing on the people that are at risk. Uh, why are we wearing the mask if you're not at risk? Is that assuming you might get it and give it to somebody? I mean, the assumption there is, I don't think, relative to what masks are for. The mask should be for those that are at risk. And so to require everyone to wear a mask, and there are certain essential businesses that aren't doing that because they're essential. 22 million health or government workers are essential, and maybe they're wearing masks or not. I don't know, but I think for those that aren't at risk, it isn't justified. For those 125 million, it may not be justified because if they've got over a chronic disease and now have their immune system is, but we should be testing immune system, not for cases of asymptomatic people. I mean, there's got to be some kind of ways that you can test a person's immune system and see, how it would react to the virus. And we plant the virus in the system, but with vaccines to see how your immune system can handle it, and then you take steps to help the immune system. So I think we focus way more on the immune system than cases and deaths and spiking and all these things that I consider not to be science. I consider those to be guessed because we don't have answers even from the past on this. And we used those same tactics in the past, and we're still here using them now. So there has to be some improvement in the way we approach this in the future.
I see. Yeah, I think that's a good point. That's a good
And
point.
as
Yeah, go ahead.
can't dictate masks for everyone. I think it's unjustified.
Okay. So you're saying mandate is not may not be a right solution because it'll get into a debate on what should be done or what should not be done. If
Right.
they give a guideline, what you're saying essentially is if the guideline is given for risky individuals or at risk individuals is when it becomes much more palatable for people. It's much more frictionless at that point. Right now it has become kind of a political issue right now, whether should you mandate a mask or not mandate a mask, right?
Well,
So
I think the 125 million that have these chronic diseases are given the choice. They make the choice. The rest of us, we can wear them, I guess, if you want. I don't think it's justified, but those that are at risk should be given the option. They shouldn't be mandated to wear a mask, where half the society is wearing it and the other half aren't. But I think they need to be tested for their immune system as well as whatever chronic disease they have. That would be a good approach for a therapy.
right.
Is checking their immune system. If the immune system is strong, no, you don't have to be concerned, other than the fact that if you get it, you're going to beat it. Which are the statistics are pretty strong on that in terms of people that get it and don't beat it are a small percentage.
Right. Okay. So I think that makes sense. So all you're saying at the end of it is be scientific in what you're mandating, what you're suggesting, rather than just go with a generic, narrative, rather than be scientific in your analysis is what you're saying ultimately.
Yes, absolutely.
Okay. Thank you, Jerry, for your time today. And I look forward to talking to you next week again.
Okay, Karthik, thanks for having me.
Thank you very much. And one
Take
second.
care.
Take care.